So far, when it comes to COVID-19, we know that older people and people with comorbidity suffer worse outcome than younger or healthier people. A new data from the Centers for Disease Control and Prevention or the CDC provides more data. Here, they report that as of May 30, 2020, among COVID-19 cases, the most common underlying health conditions were cardiovascular disease with 32%, diabetes with 30%, and chronic lung disease at 18%. Hospitalizations were 6 times higher and deaths 12 times higher among those with reported underlying conditions compared with those without those conditions. Among those with underlying conditions such as cardiovascular disease or diabetes, 45.4% of patients with COVID-19 were hospitalized, versus 7.6% of patients without an underlying condition. Between January 22 and May 30, 2020, 19.5% of COVID-19 patients with underlying conditions died, compared with 1.6% of those with no underlying condition. Also, there are some disparities between the different races when it comes to COVID-19 rates of infection. For example, among those infected and patients for whom race or ethnicity is known, 33% of persons were Hispanic, 22% were Black, and 1.3% were American Indian or Alaska Native. Interestingly, Hispanics account for 18%, Blacks for 13%, and Native Americans, Alaska Native account for 0.7% of the U.S. population, which shows that these groups are disproportionately affected by the COVID-19 pandemic. When it comes to gender, it is reported that incidence among males and females was similar overall, but severe outcomes were more commonly reported among males. For instance, cumulative incidence was 401.1 per 100,000 for males and 406.0 for females, but 6.0% of male patients died, compared with 4.8% of females. Finally, the study reports that the most frequently reported underlying conditions were cardiovascular disease accounting for 32%, diabetes accounting for 30%, and chronic lung disease like asthma and COPD which accounted for 18%, and renal disease which accounted for 7.6%. The study is important for helping us design and use better surveillance. And we can also address gender or age disparity that affects people due to the new coronavirus. Thank you for watching SciO. Subscribe, comment, stay safe.